Good afternoon, doctor. We are live. We can start the webinar, please.
We can start. Only three people will be in audience.
More will be joining.
Okay, so should we wait or we have to start?
We can start. Yeah.
Okay. Only 3 or 4 people. Okay. So, hello friends. I'm Dr. Amish Chaudhary. I'm Director of Surgical Oncology at Fortis Cancer Institute, Vasant Kunj. And today we'll be talking about cancer awareness and more specifically on cervical and breast cancer. And then we'll talk about general topics also. Okay, so let's move on. So let's first talk about the cervical cancer. So since it's a cervical cancer month, so this topic I think needs to be covered. So the cervical cancer incidence is dependent upon the socioeconomic status of the country. Wherever the socioeconomic status will be high, the cervical cancer will be less. And wherever the socioeconomic status will be low, the cervical cancer will be more. So over and around, there are about 5 lakh women which are diagnosed every year, and out of those 5 lakh, 2,70,000 women die. Okay, so you can see that it is about 50% mortality there in cervical cancer, and despite large screening that is being done in all the developed worlds, women continue to have it, and the deaths are also not declining. Okay, so now this is a geographical representation of the cancer burden of CA cervix across the world. So you can see the countries which are light pink or pink, they are the low cervical cancer burden disease. So you can see Russia, China, Australia, entire of Europe, Canada, US. So they are very light pink. So the cervical cancer incidence in these countries is very, very less. And you can look at Latin America, half of Africa, India. So they're dark pink to brown. So these are the countries where cervical cancer incidence is very high because of the lower socioeconomic status. Okay, so now what are the risk factors? Okay, so for CA cervix, the risk factor is early onset of sexual activity. So the early in age sexual activity starts in that country, the more there is the cervical cancer risk. And then there are high risk behaviors which include multiple sexual partners and or having partners which have high risk sexual behaviors which include oral and anal and homosexuality. Okay, so these are the 3 most important factors which lead on to cervical cancer. And then there are other less important, but of course they definitely contribute. That is smoking, increased number of children. Okay, if you have immunosuppression either because of immunocompromised status or because of previous cancers with chemotherapy. So these also cause increased number of cervical cancers. And low socioeconomic status, of course, that is the pattern worldwide, and prolonged use of OCPs. Okay. Now, cervical cancer is caused by a virus called human papilloma virus, or in short, it is called HPV. Okay, now HPV, you can see that nearly 100% cases of cervical cancer, CA cervix, are caused by HPV. Okay, and HPV also contributes to about 40% of vulval and vaginal cancers, 90% of anal cancers, 12% of oropharyngeal cancers, and 3% of mouth cancers. Okay, so this is the data which was there in 2001 Globocan. Okay, the 2021 data of Globocan are yet to be out, but I'm sure these numbers have must have increased. The cancer of oropharynx must have increased because there has been an increasing trend in the last decade also. Okay, so but the most important thing to remember is that cervical cancer will have only because of HPV. Okay, so HPV infection is a necessary cause for cervical cancer. Okay, so now if we limit ourselves to our country, so HPV has more than 100 strains, but out of those 16, 18, 31, 33, and 45, only these 5 strains contribute more than 95% of the cancers, and the rest will about 5%, 4 to 5% are caused by other strains. So if you get yourself immunized by these 5 strains, so there is a 95% chance that you will be saved from cervical cancer totally. Okay. Now, how do you come to know whether you are at risk of cervical cancer or not, or when should you go to a doctor? So the answer is, so well, if you have bleeding between periods, okay, or bleeding during or after, immediately after sex, bleeding after menopause, or any unpleasant vaginal discharge which is going on for long, not getting cured by medicines, all these point to having a cervical cancer. Okay. So now for cervical cancer screening exists. Okay, so Pap smear has saved more than 90% of the mortality from cervical cancer. Now, this is because three things. It is a very simple test, very easily done. It is not costly at all, very cheap, and it has a very good sensitivity. Sensitivity of picking up cervical cancer is more than 95%. Okay, so these are things. And then the most important thing is natural life of the tumor makes it ideal for screening. Now, what is the natural life of the tumor? Cervical cancer will have a very long stage 0, pre-malignant stage, which is picked up by Pap smear. So you can never have a sudden development of Pap smear. You will first have mild dysplasia, then moderate dysplasia, then severe dysplasia, then it will progress into cervical cancer. And this takes at least 5 to 10 years for these changes to happen. And so it gives you, Pap smear gives you enough chance to pick up cervical cancer in stage 0. Okay, so that is why Pap smear is can prevent 90% deaths from cervical cancer. Now, when should you do it? Pap smear. Okay, generally most of the women have done once or twice, and then they think our cervix is normal. So first of all, it is not that case. That people, most of the ladies that we see in clinical practice will get Pap smear done only after the age of 45 to 50, when they start getting screened for breast cancer. But the guideline says that you should start at the age 21, regardless of the first stage of intercourse. Okay. And then till the age of 29, you should get screened after every 2 years. And after the age 30, the screening interval should be increased to every 3 years. Okay. Now, in this case, this is for Pap smear alone. But now liquid-based cytology has come up, which tests HPV DNA also. If your Pap is normal and your LBC is negative for high-risk HPV DNA, then there is no need to repeat a Pap smear for 5 years. So nowadays, in almost all the cases, patients who are coming electively for screening, they will get a LBC done. That is called liquid-based cytology for HPV DNA. Now, when are the situations where we have to increase the level of screening? Okay, so annual screening is done if there is immunocompromised like HIV or post-transplant patients, or there is in your previous Pap smear there is CIN2 or CIN3 is there. So that means the chances of progressing to cancer is high. So therefore, there also cases you should, if you are not getting treatment for CIN2 and 3, you should go for annual screening. And you can stop screening at the age of 70 if your 3 Pap smears have been normal in the past, or there is no abnormal Pap in the last 10 years. Okay, and there's no need to do screening if you have got your uterus removal, that is hysterectomy. Okay, so this is what we have found out, that lifetime cancer risk is reduced by about 25% with single Pap smear in a life. Okay, and it can be reduced to 50% if woman takes about 3 Pap smears. So this is the impact. And if you follow the entire guideline, then there is 90% reduction in cervical cancer mortality. So this is the impact of Pap smear on decreasing the cancer mortality. Now, since it is caused by a virus, so we should be able to develop a vaccine against it. And yes, that is true. There are very effective vaccines that are there, like there are against almost all viral diseases. So now, at present in India, there are about 3 cervical cancer vaccines. Now, this slide is very, very important because it impacts every single house of this country. So now there is Gardasil and Cervarix. And now a very new one which has come is Gardasil 9, which covers 9 strains of HPV. And now Serum Institute of India has also developed our own Indian vaccine, that is Servavac, which will be launched very, very soon. Okay, and the announcement has come. I think it is just around the corner. And all these vaccines are more than 99% effective, and they not only prevent against cervical cancer, they also prevent against other cancers, including anal, vaginal, vulval, penile, and oropharyngeal cancers. Now, the oropharyngeal cancers has come up in a big way because in Western countries, we are seeing that it is not only cervical cancer, HPV is able to cause oropharyngeal cancers also. And therefore, now the screening, it's not a general recommendation, but now even boys from age 9 to 14 are also advised to undergo HPV vaccination in order to prevent oropharyngeal cancers. In India also, this recommendation is not yet has been adopted by the government, but in routine practice, this can be given on case-to-case basis. Now, the recommendation is if the girls are between the age 9 to 14, you have to give only 2 doses, that is at 0 and 6 months. And if they are in the age group of 15 to 26, then you have to give 3 doses, that is 0, 1, and 6. So it is better to have the vaccination of the girls in your homes before the age of 14, because then only 2 doses are required. Okay. And now, even after the age of 26 or even after marriage, there is still a good amount of chance that you are HPV negative, and even those ladies can also opt for cervical cancer vaccination. And after the age of 35, you can get your HPV DNA tested, and if the high risk HPV DNA is negative, then also you can undergo vaccination, and it will give you protection. Okay, so that is it about the cervical cancer. We'll be moving on to breast cancer. So if there is a question in the chat, let me just check. There are no questions as of now. Let us move on to the breast cancer part. Yes. So now, as you know, that cervical cancer can be detected very, very early. It's a long stage 0 in this disease. Now, the same question arises for the breast. Can breast cancer be detected early? The answer is yes. It can be detected early, but not so long before as in cervix, because screening generally cannot detect pre-malignant stages in breast. But there are a lot of other advantages of screening early, because earlier the cancer is detected and treated, the better are the chances of the patient's recovery. Okay, so if you're diagnosed in stage 1 or stage 1A, your chances of recovery are nearly 100% nowadays. Okay, and early diagnosis is the only key to surviving a breast cancer. Okay, and 97% of women who are diagnosed with breast cancer at early stage will survive for more than 5 years. So you see, the survival is extremely long. So this slide does not say that the early stage cancer will survive 5 years. They say they will survive more than 5 years, and after the 5 years, we don't calculate the data. The women continues to live. So there's a difference in perception of the oncology data and the general population. So we calculate only for 5 years. After that, we stop tracing what will happen, because we consider that if the cancer has not come back for 5 years, it will not come back. So 97% of the women who are diagnosed in stage 1 will survive. Now, what are the risk factors? This is for breast. This is a very, very general awareness question. Most of the women will ask me, sir, what are the risks? How do we get it? So now you should understand the first and the most important risk is the family history. If you belong to a family in which breast and ovarian cancers are happening, then your risk is definitely more than the general population, and it's a non-modifiable risk. And this risk also translates into genetic risk. So now there are genes called BRCA, or popularly called as BRCA genes. If the mutations are there on those genes, so it makes you susceptible to breast, uterine, ovarian cancers in women, and in prostate cancers in males. Okay, but prostate cancer in males will happen at a very later age, and there is no therapeutic intervention to stop those cancers from happening. So therefore, it is a part of only screening, not in a preventive strategy. But in breast cancer, we can do, if we know this information prior hand, we may be able to prevent breast cancer also. Okay. Now the next non-modifiable risk factor that comes is the menstrual history, the race. Okay, the menstrual history is that if your periods are for very long number of years, then it also exposes you to long duration of estrogens. That also increases breast cancer risk. And race is not very important in India, but it is important in the Western world. Like certain Jewish races, Ashkenazi Jews, they were very high incidence, and therefore the race is an important part of the questionnaire in the Western world. Now comes the modifiable risk. All these were non-modifiable. These are there with you. You cannot change them. You can only be more aware for screening and other things, but they cannot be changed. Now comes the modifiable risk. The modifiable risks are reproductive history. So now in breast cancer, remember the age of first childbirth is very important in your risk factor. The earlier the age of first childbearing and lactation, it provides protection against breast cancer. So if your age is less than 30 when your first childbirth happens, then you are significantly protected against breast cancer. And if it is age after 35, your first baby is happening, then your chances of breast cancer increase. And if you don't have baby at all, then your chances of having breast cancer is very high. Now, oral contraceptive pills, this relates to the amount of estrogen that those oral contraceptive pills have. The longer the amount of estrogens that we take, the more is the chances of having breast cancer. And the same thing applies to hormone replacement. Since hormone replacement is largely based on estrogens, any hormone replacement therapy, that is the youth hormone or ever young's tablets that are being taken for more than 5 years, it increases your breast cancer risk. And alcohol and weight, these are the general risk factors for almost all cancers in the human body. That if you have your BMI is more than 30, your alcohol intake is beyond 85 ml a day, so all this will lead to not only breast, all other cancers also. Okay, so this we have covered. Modifiable risk, that having no children increase the risk slightly, and having your first child after the age of 30 is also a risk factor. Okay, this we have already done. Obesity is an important risk factor, and this is not only a risk factor for breast, it is there for colon, for prostate, for a lot of other cancers also. Now comes the physical activity. Now physical activity, we know it is very good for other lifestyle diseases also, like hypertension, management of diabetes, management of abnormal lipid profiles, and now it is well documented to be to help indicating your risk of cancer, not only breast, more evident in breast, but also in other types of cancers also. So physical activity up till the age of 40 years, it is a very, it decreases the risk of breast cancer. And there was a large Norwegian study which was done, and which showed that there is a 37% decreased risk of developing breast cancers in women who exercised regularly. And the greatest benefit was in the age less than 45, and after the age of 45, other environmental factors and genetic factors contribute. And then the benefit is not that clearly evident, but physical activity should still be continued because it will have a lot of other good effects also on general health. Okay, so now after risk factors, now we'll discuss how do we screen breast cancer. So there is 3 ways of screening. The one is the screening mammography that we all know, and then the 2 most important ones, and which are often ignored, are called the self breast examination and a clinical breast examination. So a combination of any of these 2 will give you a very good sensitivity. Now, what are the recommendations? The recommendations for mammogram is an annual mammogram after the age of 50 years. Now, most of the women will get 1 mammogram or 2 mammogram after the age of 50, but most of the women will not opt for yearly, and the recommendation is annual, because there are a lot of breakthrough cancers. So 1 mammogram now and 1 mammogram after 3 years, there is a significant risk of developing a cancer in between those two. Okay, so mammogram is good only if it is done every year. Okay, now clinical breast examination is done by a doctor. It is done after every 3 years in the up till the age of 40 and yearly for after the age of 40. But this can be replaced by self breast examination. There is no need to go to doctor only for breast examination yearly, and breast examination should be done monthly or 3 monthly. Okay, now we'll teach the women how to do a self breast examination, because this is very, very important. This is the first line of defense. Okay, so now first is while you are taking a bath in the shower, you can use your pads of your fingers. Okay, so you have to remember that only the fingers have to be used. Thumb is not to be used. Only the fingers have to be used. You have to feel gently over your breast to feel any changes in the breast, like any lump or changes in the skin. Okay. Second is, after the bath, you will stand in the mirror, in front of a mirror with hands behind the head, and then you will look for any unusual discharge, dimpling, changes in the skin texture. If it looks like an orange, then yes, you have to immediately go to your gynecologist, or any changes in the shape. Now, change in the shape means recent change. What has not been there for 40 years and is now there. Okay, that is called a change. Okay, not a change between left and right. Okay, changes which have occurred recently. Okay, and you have to look for any nipple discharge. And third is, you lie down flat, and then in this manner, you can see the zigzag manner, you move your fingers without the thumb. Okay, and then you look for a lump, any new lump that has developed. Okay, and any change that you see in any of these three things, 3 self breast examination techniques, you should immediately consult your gynecologist or get a screening mammogram done. Okay, so abnormal breast change. What does abnormal breast change include? It will include lump in the breast, any changes in the size, nipple tenderness or discharge, or changes in the skin of the breast. If there is no lump, but there is thickening of the skin or any dimpling in the skin, that is also considered a change if it was not there previously. So that is about breast cancer screening. Now there are a lot of myths about breast cancer and cancer in general. So let us see what do people say and what is the fact. Okay, now there's a myth number 1, that is finding a lump in your breast will definitely means that you have breast cancer. So mind you that most of the lumps are benign lumps in the breast, even if they are newly developed lumps. Okay, so even in clinical breast examination, if there's a new lump that has developed, there's a large number of patients who will be benign, that means not cancer lumps, and only few of them will develop cancer. But this distinction can be done only on investigation. Therefore, you should not keep this to yourself. You should immediately consider a gynecologist. She is the one who will diagnose it for you. And therefore, you should not be afraid that a new lump has developed. That means that you definitely have cancer. No, only very few of them will eventually come out to be cancer. Okay, now the second myth, that I don't have breast cancer any in my family, so therefore I cannot develop. And this is a disease of familial syndromes, and I am not from this family, so therefore I will not develop. The truth is that only 10 to 15% of the cases will have breast cancer family history, right? Whereas 90% of them will have breast cancer without family history, and that is because of the environmental and the modifiable factors and the lifestyle changes. Okay, so anybody can develop breast cancer anytime, and therefore you should never be confident that I am not a breast cancer family, so therefore I will not develop. So therefore I don't need screening. Okay, so this is the second myth. The third is almost all men believe that breast cancer is a disease of women only, because we have never seen heard men having breast cancer. Okay, so the reason is that the total number of cancers, if in a year are 100, then out of those 100, every year one person will be male. Okay, because the male breast also has the same ductal tissue which the female has. It is just that the receptors are very less in the male breast. Therefore, they don't develop breast cancers. But it is not that they cannot have. Okay, 1% of all breast cancers will be men, and we do see these patients every year. Okay, and there's another myth that it is a disease of old age. Women in 50s will get breast cancer and not before that. So now what we are seeing in the past decade or 2 decades is that the breast cancer incidence, which was initially in the 50s, had dropped down to 40s, and now we have started seeing in 30s. Okay, now this is largely due to one increased socioeconomic status and changes in lifestyle, and there is a lot of changes that are happening in our environment, which are pollution, stress, adulterated food, adulterated milk and milk products. All these are contributing to increased breast cancer risk, and therefore we are seeing more and more younger patients. Now, this was a myth in the last decade. This was very popular that deodorants cause breast cancer, because there was a study published, which was a European study, which showed that there are deodorant cells present in the breast cancer tissue that they sampled. So now the reason is that we use deodorants in our underarms, and our underarms are the lymph nodes, which are the same drainage area of breast cancer. So whenever we spray chemicals on our skin, they also get absorbed, and they are routinely in any way also they are deposited in the lymph nodes of the axilla, and therefore it was largely to be taken as a coincidental finding rather than a causative finding. So it is just that most of the women will use deodorants, and if breast cancer will develop in very little of them, they will have some deodorant cells there. So it was not linked to be a causative agent, but yes, it was associated with it. Okay, and high-fat diet can cause breast cancer. So as far high-fat diet is concerned, it was not conclusively proven that high-fat diet will cause breast cancer. Okay, obesity was known to be a breast cancer factor. High-fat diet was not, but high-fat diet has been a culprit for a lot of other diseases, like deranged lipid profile, increased cholesterol, deranged glucose tolerance, or in pre-diabetes, obesity. Okay, so anyway, this diet is not good, but it does. But high-fat diet does not directly cause breast cancer. Okay. Now the other thing is that injury causes breast cancer. So this is also wrong. It's also a myth. Because injury only causes your attention towards the newly developed lump. Because when some injury happens, if there is a lump, it becomes tender. Therefore, you start noticing it. Otherwise, injuries keep happening, but breast cancer is very, very little. So injury has nothing to do with breast cancer. And the third is that if you have developed breast cancer, you will probably die either today or next year or day after. You don't have much to live, and it's like a kind of a death sentence. So now this is a Google created phobia. So remember, see, breast cancer is for general population, it is one disease, but for the treating oncologists, it is a conglomerate of many diseases which have totally different biological behavior. Now within the same set of breast cancer, you have diseases in which in stage 4 you can live for years. And there are disease biological sets of breast cancer in which even in stage 1 and 2, 2 or 3 years may be difficult. Okay, so as and when more and more the DNA pathways of breast cancer are being explored and identified, and their blockers are being developed, the survivals are increasing. Okay, so the classical example is HER2 positive disease. When Herceptin and Perjeta came into the picture, and their combined effect was being given after the Cleopatra trial, the survival increased extraordinarily. Okay, so once which was considered a very dreaded disease, suddenly became extremely curable disease. So I think that is the end of my presentation, and I guess cancer research is on, and it's a long way to go. And the science and the society both will walk hand in hand, and I think we will go past this dark wood of cancer, and soon, maybe in 2 or 3 decades, we'll overcome this disease also, like we all fought together and overcame COVID. which was once when it came, it was being thought that we'll not be able to fight it, but we did and defeated it, and so we'll defeat cancer. It may take time, but we will. Thank you. So any questions regarding any other cancer? Breast, cervix, or things?
Doctor, we have few questions that are there in the chat window. If you can just answer those, please.
HPV also causes genital warts. So are genital warts a form of cervical cancer? No, genital warts are not a form of cervical cancer. Warts are warts. They are excessive growth of skin. But yes, if you take HPV vaccine, it will prevent HPV warts also. Are there any supplements or diets to control these cancers? So there are no supplements, but there are diets which can give us some amount of protection, not proven, but some. So one is low-fat diet. The second diets rich in antioxidants, which are fruits, nuts, berries, things like that, which can help reduce stress and also fight stress and pro-carcinogens. And more and more things keep coming on internet and WhatsApp, like don't use plastic for heating in microwave, don't use vegetable oils for extreme high cooking. So all these things, they have not been proven, but they have been there for a while. So if you can avoid them, avoid. If you don't, it's not a major issue. What are the tests women need to done to monitor any kind of cancer in the body, and how often they should get the test done? So this is what I have explained. For women, there are only two tests that you should do. One is annual mammogram starting age 45 or 50, and one is pap smear every 3 years after the age of 30. Or a liquid-based cytology after every 5 years. And then the other is that whenever you're getting a blood test done after the age of 45, you can get a CA-125 done. And I don't think there is any other test which can. Can we say that PCOD may lead to causation of cervical cancer? No. PCOD is itself a hormonal syndrome in which polycystic ovaries come, and now the current management of polycystic ovary disease is now management of weight and calorie intake, and most of the PCOD cases are reversed if you are on a very, very good strict diet and exercise plan. If you drop 10% of the weight of whatever you are, either your PCOD will be reversed. It's a lifestyle and a hormonal change in your body, not a disease. Can prolonged hormonal medication increase the risk of breast cancer? Yes. Any prolonged use of estrogen, whether it's a form of estrogen OCPs or in the form of hormonal replacement therapies for looking young, they will cause increase in breast cancer. Can lactation to an infant also become a reason for breast cancer? No. It is the only known protective method for breast cancer. Lactation is our only known protection against breast cancer, and the earlier the lactation happens, the more protected you are. This question we have already answered. What's the next question? PCOD we have answered. Thanks for this and help creating awareness. Okay, thanks, Shweta. The lactation question we have already answered. Lactation is protective. Are irregular periods would be the issue for cancer? No, irregular periods are not, but in between periods, if the bleeding happens, that may be a sign of endometrial and cervical cancer. Irregular periods per se, they are an indicator of some other disease like PCOD or something else. They are not per se an indicator of cancer. Are there specific food carcinogens that affect a specific organ? Yes, tobacco and alcohol. the curse on mankind. Tobacco causes 12 types of cancers. Okay, right from oral cavity to oropharynx to larynx, voice box, esophagus, stomach, pancreas, urinary bladder. Okay. Rest of the diets are all okay. Is it normal to have change of breast color during pregnancy? Yes, quite common. I've already answered. Palishri Das, that's the next question. Does number of stages vary organ wise? So yes, each organ has a different stage mechanism, which is called staging. But for the general population, you remember there are 4 stages of cancer: stage 1 and 2, which are localized to the organs. Stage 3 largely is the spread of to the region. After the local spread, it is the regional spread, that is to the lymph nodes in and around the organ. And stage 4 means if it involves some other organ somewhere else, if it leaves its own place. So these are the stages. Is it true that vegetarian have lower chance of getting cancer compared to non-veg? Yes, this might be true. It's not a very substantiated claim, but a claim which has stood the test of time, but only in colon cancer. That vegetarian diets are people have very little chance of developing colon cancer as compared to the other thing. Can erroneous sleep-wake cycle be a cause of cancer? It cannot be a per se a cause of, but it can be a precipitating cause. Any stress can be a precipitating cause of developing a person who is already at risk. It is not a risk factor person. Deficiency of B12 can lead to cancer. No, it can only lead to anemia and weakness and decreased immune system. What kind of test should women take from the age 30 to 50? Annual mammogram, every 3-yearly pap smear, or every 5-year liquid-based cytology? When is Indian vaccine will be available to the masses? Very, very soon. Very, very soon. Okay, this has already been announced. I think it is just on the in the rollout phase. It will be available with the name of Servavac from Serum Institute. Okay. So thank you for all the questions. And I think we can sign off from this session and hope to reconnect to you again. Until then, regards and stay safe and keep getting screened from Fortis Cancer Institute, Fortis Vasant Kunj. And you can reach out to us if there is a question or a doubt that comes to your mind. Okay, like hardening of skin after bath and tingling numbness in the hair can be the, yes, that's the same. It's a symptom of deficiency of vitamin B12 and folic acid. That is that comes under the neuropathy, not under the. It's not a symptom of cancer; it's a symptom of neuropathy. So benign and malignant. Benign means that the tumor which does not spread, and malignant means cancer. That means the tumors which can spread. Is thyroid dysfunction have any repercussion of cancer? No, none at all. Nor it is a risk factor for thyroid cancer. Thyroid function is only for the thyroid function. Ritika Jory's question is a repeat question you have already answered, that vitamin B deficiency causes some neuropathy, not cancer. Any further questions? I think we have answered all. So major lung cancer and tuberculosis. So lung cancer and tuberculosis have nearly the same symptoms. Both will cause cough, some amount of pain, and some other chest irritation. So they're largely the same, and it is a very commonly diagnosed condition that to have concurrent both tuberculosis and lung cancer. So the symptoms are almost nearly the same, just that in tuberculosis you may have fever and cancer will not have fever. The rest, most of the symptoms will be nearly the same. And even in PET-CT also, tuberculosis and malignancy looks nearly the same. Okay, so there are other factors, biopsy and stuff, which differentiates them. Otherwise, tuberculosis is there's a lot of overlap with malignancy. And I think that's it. We can end now. So regards from Fortis Cancer Institute, Fortis Vasant Kunj, and thanks. I think we should stop share, and therefore signing off. We can leave the session.
Thank you, Doctor.